welcome back. We're here live at the GuideWell Insights Lounge on location at the Oliver Wyman Health Innovation Summit. My name is Kate Warnock, and I'm delighted to bring another repeat guest. We're having all of our friends come join us. This is John Kao. He is the CEO of Wyman Healthcare. John,
hi, Kate. Good to see you again.
Good to see you too. So, and we see Wyman is all over this event. You're one of the big platinum sponsors, aren't you?
It's a great event.
Yeah, it is a great event. So, all right, so John, in an interview with Oliver Wyman earlier this year, you published an article. You took a position about who was better equipped to disrupt the health industry. Can you share that perspective with us?
Sure. In California, we are a health plan. So we get a lot of digital health companies and vendors wanting to work with us. In Florida, we partner with Florida Blue and GuideWell, and we're a provider. And in North Carolina, we are also a provider working with a large hospital system. And so we have a unique view of working with health plans, providers, hospitals, and also being a plan ourselves. And what we've discovered is the digital health companies have new solutions, new technologies, but they really don't, in my opinion, have the experience to navigate through the health services ecosystem efficiently. And so what I think is happening is the health plans in particular are beginning to hire certain individuals from the digital health world and realizing that the future is now. Mm-hmm. And companies like ours are beginning to make investments and begin that transformation process to get to a state of what I'll call disruption, but we would call it disruption from within.
Right.
Because we know the ecosystem, we're learning the tools that these digital health players are bringing to the table, and then we're now integrating them into distinct workflows inside our company. And so I think that from what I've seen, certainly GuideWell is on this path of driving innovation and change from within. Mm-hmm. That's kind of our view.
All right, that's a good argument to make. All right, so John, part of the strength of Wyman Healthcare is you are in the home. You're working with the frail elderly, folks who have maybe a lot of chronic conditions that they're dealing with. So how do you see remote in-home technology evolving? And are robots and virtual assistants next? Is this population that you serve ready for that?
Yeah, it absolutely is critical, I think, currently and in the future. We use remote monitoring now on the sickest 5% of our population.
Okay.
And we have tracking mechanisms for weight, glucose, and we just monitor them 24/7. And every single day we have them input, and it automatically actually inputs data that our nurses receive every single day. Mm-hmm. If there's a variance or something abnormal, we call the member. We'll even go to the home and care for them at home with our Care Anywhere nurses. So it's working, and the efficacy of that program is wonderful.
Right.
From a care delivery point of view, we've saved lives. The readmission rate, for example, in North Carolina for the people using this tool is 0.
Oh,
so
wow.
It's working. The most important thing is we're giving a sense of security for these members, that we're kind of helping them and watching them and being there with them 24/7.
So maybe what you were saying based on your first response is that these digital assistants that are out there, you're learning the best, maybe the best use cases for it and integrating it into your care delivery.
We are doing that now, and what I see is with the Alexas and with the Google Homes, these tools are going to bring the price points down for insurers and care deliverers to deploy them more at scale.
Yeah.
I think that's going to happen. And I think the technology and the logic that's being built now using these tools is going to be the norm within the next 12 months, I think.
Wow.
Yeah.
That's short, okay.
And I think with respect to the last question, are they ready? Absolutely, and I can say that because my mom is 84 years old, and we try remote monitoring on her.
Yeah.
I go, if my mom understands this, anyone can understand this.
And anything that's going to keep them independent and autonomous in the home and safe?
Independent, it's got to be easy to use.
Right.
Easy to use, not complicated, and they are adopting it. And I think from our point of view, these tools have to be additive to their lifestyle,
Sure.
not a burden to them.
Sure.
And we've gotten feedback what to do and what not to do. So
Direct from the consumer, that's where it should come
they're,
from.
they're, they're going to use it. They
Yeah.
love it, actually.
All right, John, my final question for you, knowing that really quality of life is really the focus for your company. You are
Right.
really trying to improve quality of life for your patients. How might you like to see access to palliative and hospice services expand for this population?
It's critical. Quality of life and talking about palliative and hospice care is always a sensitive topic.
Sure.
But we've learned just through the years that it's better to address these issues earlier through the process.
Absolutely.
And so the first thing we've done is be very proactive in taking the data that we have and identifying members that potentially should be in chronic disease management programs, palliative programs,
Okay.
and hospice. And so what we've done is first know who our patient is, and we've very proactively put care plans in place for each one of them by deploying our Care Anywhere nurses that care for these people at the home. And the outcomes will
Speak for themselves
speak,
almost?
well,
Yeah.
they'll make you cry how good
Yeah.
the care is for these people that need
Yeah.
it the most. So much so that when someone that is a member of ours joins hospice, we have continuity of care where our doctors and nurses will still care for that patient even when they're in hospice. And we learned that many years ago where a daughter of a member would say to us, well, my mom just joined hospice, why are you not seeing them anymore?
Right.
And we said, that's a good point.
Right.
And so from then on, we just have all the people that cared for the member during the chronic phase, the palliative phase, still see that member, that patient actually, even though they're not a member, while they're in hospice.
Right.
That's the whole quality of life continuum we got to aspire to.
Well, that's really a best case scenario, and so hopefully more will model what they're doing on the Alignment healthcare approach, because it really is so humane.
It's just the right thing to do.
It is.
With the member and the family.
All right, well, John,
So-
it's always a pleasure to have you with us here in the GuideWell Insights Lounge, so thank you for being with us.
You're welcome. It's always good to be here.
My pleasure. This is Kate Warnock. Please keep watching. We're going to be up soon with another interview.